Good morning, friends. Today we'll discuss about incubation period. So I will say some of the mnemonics so that it will be easy for you to remember. So, but one thing here is they won't ask directly like what is the incubation period for mumps. So what is the incubation period for rubella? Okay. So make clear that, and so they'll be asking like clinical questions only. So a patient came with the complaints of that fever. It was about for 2 weeks. So then he developed the rashes. So like that only they will be asking. There won't be a straight questions for incubation period. Okay, is it clear? So first we'll start with MMR. Okay, so first it is easy to remember, right? So mumps, measles and rubella. So for this there is nothing you won't remember. Just remember 19, 10, 14. Okay. So it is like a year. Okay. So just remember like that. And so 19, 10, 14. Okay. So hereafter I will be saying the mnemonics. So first it is in smallpox. So just count the letters. 1, 2, 3, 4, 5, 6, 7, 8. So it is in 8 days. And again for chicken pox it is 10 letters, so it is in 10 days. So roughly, so it will come, it is about 14 to 10, 16, but mostly it will be around the 10 days. Okay. So next we will discuss about diphtheria, pertussis and tetanus. So for diphtheria you can remember like D. So D, it is in fourth alphabet in the, what is it? It is in fourth alphabet. Okay, so there is in 4 days. For pertussis it is in 9 days. You can remember like it is in P, right? So if you put like this it becomes a 9. So 9 days. And for tetanus it is in 10 days. So always remember if anything starts with T, so except tuberculosis it will be roughly around 10 days, because for tuberculosis you know it has a longer incubation period, right? So for tetanus T, so just remember 10 days. Okay. So next, for dengue and yellow fever it is in 6-letter word, so it is in 6 days. And for yellow it is in 6, so 6 days. Okay. So always remember like, so mostly it will be coming like an so if you spell the words or if you count the number of the words, so that will be an incubation period for some of the diseases. Okay. There is no other way you want to remember this. So just I want to simplify this. So I created this mnemonic like so letters or the numbers so that it is easy for you to remember. Next, so meningococcal meningitis. So men, it is in 3. So always remember like, if you're spelling it as men or flu, it has to be complete word. Then only you want to count that. So if it is men, yeah, so it is in 3 days. For Japanese encephalitis, it is a 20-letter. So it is in 5 to 15 days. Okay, so 20 days only. Okay, roughly it will be like 20 days. So next I told you, if anything it starts with T, it is always 10 days only. So 10 to 14 days for typhoid. So cholera, so there is a, I told you for MMR there is no mnemonic. Again for cholera I can't help you. So you won't remember for 1 to 2 days. You can remember like diarrhea, it will be very rapid, right? So it won't be like there won't be long incubation period, something you remember. So cholera 1 to 2 days. Okay. Again for MMR I told no, it is a 19, 10 and the 14 days. So again for cholera it is 1 to 2 days. Okay. So next we will discuss about hepatitis. So A, B, C, D, E, right? So remember like this. A, it is in 1 month. For B it is in, so you can B, it is B, right? So B like 3, so 3 months. C, 2 months. So C, you can make it as 2, so it is in 2 months. Always remember B and D are always friends. So this is 3 months and again this is 3 months. And A and E are the friends, so 1 month. So here the B and D are the friends, that is a 3 month. And A and E are friends, that is in 1 month. So which is left out is C, that is in 2 months. Okay. So next, Influenza. I told already, meningo. So men means 3 for 3 days, and influenza again flu. It is in 3 days. Okay, so flu, men, both are 3 days. So coming for plasmodium. So you can remember, like, first it is in vivax. In colleges usually the viva will be around 2 weeks once, right? Even though the internal assessment will be weekly or monthly, but viva it is usually recommended as 2 week. I means once in a 2 weeks. So 14 days. Okay. So falciparum, just count this. It will be 10. So FAL CAPARUM 10 words, so it can went as 10 days. So malaria, so always remember something MA starts with, so just as a month, MA or MO month will be having in 30 days. Okay, so 30 days. And for ovule, you just remember an ovulation. So for ovulation it is in 14, so 14 days. Okay, so these are some of the hint for remembering the incubation period, and I think it will be useful for you. And so these are the important incubation period which have been asked in the exams. Okay, so don't read for all the diseases and make it as confusing one. And these are repeatedly asked questions, and again I am saying that they won't ask it directly. Okay, only in the form of clinical questions they will be asking the like this, and it will be useful for the diagnosis. Okay, hope this video is helpful. Thank you, friends.